Hey, everybody. Good afternoon. I'm so glad that all of you could join us today for a really important discussion about healthcare for our veterans here in Arizona. Veterans healthcare is an issue that hits very close to home for me personally. As you may know, I served in the United States Navy for 25 years, and I understand the commitment that our troops make to our country when they put their lives on the line to defend it. And too often, when they come home from service, our federal government has failed to give them the health care that they deserve and that they earned. Now, here in Arizona, we have about 500,000 veterans, and they're a huge part of our state's community. Now, we've all seen the issues, the scandals that have plagued the Veteran Affairs healthcare system here in our state, including in 2014 when more than 35 veterans died while they were waiting for their appointments. Patients were supposed to be seen within 14 days, but were in fact waiting an average of 115 days to see a primary care physician. Though wait times have been since cut down, there's still a big concern. Veterans in Arizona are still seeing long wait times in places like Lake Havasu City and Tucson, here in Tucson, and Surprise. The public health and economic crisis brought on by this pandemic has highlighted many of the issues that are in our veterans' healthcare system. And in the wake of this pandemic, 7.3 million appointments with the VA healthcare system were canceled, and a third of those received no follow-up. Those veterans seeking health care services are now at an increased risk. Now, there are also concerns over the Postal Service, since the VA fills about 80% of its prescriptions. That's done through the mail. The USPS is fundamental in getting prescriptions to our veterans, and a delivery delay could be catastrophic for patients. So we have to do better, and we owe it to those who served our nation. I mean, they made great sacrifices, all of them, for our country. And they made a promise to serve our nation, and now we have to fulfill our promise to all of them. We got to make sure that our veterans are getting the care that they deserve, including the mental health services that so many vets need after experiencing trauma during their service. So we got to make sure that the USPS is getting the funding it needs to ensure that veterans receive their health care, receive their prescriptions on time. And we have to protect Social Security and Medicare, programs that Arizonans rely on to live with dignity in their later years. The recent attacks on Social Security and Medicare by this administration show that Washington has not done its job to ensure that Arizonans have the resources they need to get by. We have to return decency and empathy to our politics in Washington. And we deserve leaders who can show us a path forward and work in an independent way to get it done. And that means working with members of Congress who have good ideas, regardless of whether they're Democrats or Republicans, and bringing the focus on science, data, and facts back to Congress. It's an opportunity to build a stronger future for Arizona and ensure our veterans are served with the same dignity with which they served our country. And to all of you on this panel today, I want to thank you for your service to our country and your service to our veteran community. Now, let's get started with our conversation. We'll have the panelists first introduce themselves. I'm going to start with Dr. Collinson first, and then we'll kind of bounce around a little bit. So Dr. Collinson, please introduce yourself and share a little bit about your background working with veterans.
Yeah, thank you, Mark, and thank you for having me on this panel. I think my role with the veterans is to get a perspective on healthcare. I'm a private care orthopedic surgeon, 3 generations of physicians. My father was a Iowa farm boy, but a naval officer in World War II, did 40 years of practice, and he brought in 8 additional primary care physicians into his practice. He convinced 5 of his sons, including myself, to become physicians, and we all come from different specialties primary care, surgical specialists, radiologists, dermatology, and each of us are in different clinical situations, hospital-based, academic-based, medical directors, HMO directors. I even have a few nieces and nephews that are carrying on the tradition, but you know, I grew up in Iowa, biochemistry, and went to Iowa, but I did my internship in Canada, so I got a very good perspective on single-payer healthcare system in Victoria, British Columbia. And then I did my trauma training in inner city Detroit. And I've basically been in private practice since 1985. I retired in 2012, but even as I was retired, I did go back to the VA to do what they call the Volunteer Physician Ambassador Program. But when I came to Prescott, you know, as I was saying before, we have 3 VA hospitals. Our northern VA system, I was a outside consulting physician there in 1985. And I ran an orthopedic clinic there once a week for about 3 years, and basically dropped out of that in my private practice, continued my private practice, getting occasional consulting referrals for surgical cases, most of which were being referred down to the Phoenix VA. But in 2008, as I was starting to ramp down my surgical practice, I went back to the VA after they needed orthopedic help. They had not had an orthopedic surgeon at that VA since I was there in 1985, and this is 2008. So I was there for 3 years, basically on what's called fee basis, or as an outsider physician. I was not employed, but I worked within the building and ran that clinic. And the amount of backlog of neglected orthopedic care was astounding, basically due to some administrative disagreements and also fee basis funding. My clinic was discontinued in 2011. I had over 480 consults pending. Most of the veterans that I had not or had neglected care for 2, 3, 4 years. I was referring those surgical cases, since we no longer had an operating room up here, to VA down in Phoenix, and they shut me off. Basically, they said, quit sending all of these neglected cases to us, even though it was their obligation having a surgery care. So as you heard, you know, the crisis in 2014 in Phoenix with the 2 waiting lists, the 1 waiting list, I totally understand how that happened. I kind of understand what they were trying to do to me back in 2011, because many of those administrative bonuses were tied to production of what I did, not what they did, but what they pushed me to do. And then in 2017, our newspaper had an ad from our VA looking for a physician ambassador, looking for fully licensed, board certified physicians to come work at the VA for free. And I had done a number of volunteer medical missions in many other countries: Guatemala, Honduras, Mexico, Peru, Spain. My wife and I live half the time in New Zealand. I'm very familiar with many different healthcare systems in Europe, Australia. And I said, I will give to our veterans. And it took me over a year to get credentialed as a volunteer. And once I got credentialed in 2018, my services were in primary care, teaching nurse practitioners and PAs how to inject shoulders and knees and any other orthopedic care, since most of primary care is about 60 to 70% musculoskeletal. I sat in a room there for 2 months, 1 day a week, sometimes 2 days a week, for 4 hours, and I got only 2 requests from 1 nurse practitioner. He wanted me to show him how to inject a shoulder and a knee. So I basically walked out after I warned him multiple times, if you don't want to use a specialist service care. So it's a dysfunctional amongst how they deliver healthcare there. And
Richard, I'm gonna have some questions in a few minutes. I still want to get around the room so everybody has.
that's pretty much it. I just want to say what my role was. Thank you.
Yeah. So Deborah, could you tell us a little bit about your background, where you are, and just what your
Bluff.
VA
The
health.
Bluff. So bottom line up front, my name is Deborah Martinez Garibay. I am a native of Tucson. My parents are local. I joined the Army. I was medically retired from the Army after multiple tours, a lot of different kinds of missions, doing some cool stuff. And I just got very involved with the Tucson veteran community. It's something that I think I see with a lot of vets that maybe sometimes can't verbalize, but I had to find my goal. I had to find something that still kept me driving, something that gave me a purpose and a mission. And so if you can think about it with the Tucson veteran community, I'm pretty much involved. A lot of my focus for the last year and a half has been on homelessness and treating and working with our vulnerable population. My goal is to kind of get all the resources, because there's so many programs, and make them more inclusive. Everything is exclusive. Everything is, I feel like it starts here, right? And you're like, okay, so you're a veteran, but you didn't go to this conflict, and you're not a woman, and you're not a man, and you're not an amputee. And eventually you exclude everyone from all the programs. So it doesn't matter how many are out there, people can't use them. And I have plenty of experience at the Tucson VA. It's a very, Sanoa's laughing at me, you see it, right? She's like, but it's true. It's like, I always tell people, it's like a bad relationship. Like sometimes they're really good to you and it's like a love affair, and sometimes they're unbelievably abusive and you wish you could leave, but there's nowhere else to go.
Sorry to hear that.
Yeah.
We'll come back to everybody here in a minute. So Jody Logan, over to you. Just a little intro.
Okay. Well, I'm a 65-year-old veteran of the Air Force. I served in between 75 and 79. I'm currently under the VA system, have been under the VA system hospital-wise since I left the service in 79. I was involved in a motorcycle accident when I was in the service, so I'm disabled due to the accident. And right after I got out of the service, I needed surgery on the shoulder. So I went right into the VA system right from when I was right after I was discharged up until today. I live in Phoenix. I'm still working. I'm not retired. I'm a go-getter. And there goes my dogs again.
Dog. How about over to Larry?
Hi, my name's Larry Trush. I'm originally from Philadelphia, but I've been here for the last 23 years. I'm a retired Philadelphia police officer. I'm a retired CPS investigator, and if there isn't anything I haven't done. I'm a Vietnam combat veteran infantryman, and
Larry,
I kill.
2 Purple Hearts.
What's that?
2 Purple Hearts.
Yeah, I got 2 Purple Hearts, and I get all my services from the VA, basically.
Larry, you remind me a little bit. My dad would be much older than you, and he's passed away. But you kind of remind me of my dad. My dad served in the Army right before Vietnam, like up to about 1961, 62. He was in the 82nd Airborne, but then he was a New Jersey cop for 25 years. So rather similar background. And then finally, Shanoa.
Yate, Shea, Shanoa, Bahi, and Chia, Kia, Ani, and Sloan, Not Odine, Bashish, Chin, Deshti, Nisha, Kabahan, Ishanala. So it's customary in our culture to introduce ourselves. My name is Shanoa Bahi. I am the Tarring House clan, born for the Tobacco clan, and my maternal grandfather is the beginning of the Red Streak, and my paternal grandfather is the Water's Edge clan. I'm originally from Arizona. I am from a really small community called Wood Springs, Arizona, on the Navajo Reservation. I am a 12-year Air Force veteran. deployed 4 times in support of OIF and OEF. I'm also I also have service connection disability. I actually used to work for the VA, but not Arizona. I worked for the New Mexico VA. And so I currently work in Flagstaff at Northern Arizona University as a program coordinator with military and veteran services. I'm kind of like the link between NAU and the VA for students that are utilizing educational benefits, whether they're the veteran or the dependent. And as far as VA healthcare, it was hard to get into the CBOC here in Flagstaff. I've been here a little over 2 years, and my first appointment was in May, I think. And so being that I used to work at the VA, I was an MSA, that's a medical support assistant. In New Mexico, we were told that you never send a person a voicemail. Like if a patient called, like you had to, and every time I call the Flagstaff CBOC, it's just always, nobody answers the phone. And so, but I understand with the pandemic and stuff. So my first appointment was, it's still new for the Arizona VA right now. But thankfully, because of where I work at, I have access to the NAU healthcare system, but I still get like my medication from the VA. So they send me my medication that I need, so.
Okay, so let me, I'm going to go back over to Larry for a second. So Larry, in your work with a lot of veterans in the community here in Tucson, I understand you have a lot of connections with them and understand some of the challenges that they're facing. What are you hearing from them now with regards to their health care?
There's a lot of homeless vets out there who need care, but they don't, from VA, but they don't get it because they don't follow through with the programs. Because they've been living on the street for so long, and there are other ones that don't qualify, and I think every veteran should qualify somehow or other, but they have certain limits on who they qualify, who they don't.
Yeah. So for folks who are watching this today, just so they're aware, if they don't know the details of how the veterans healthcare system works through the VA and VA hospitals, every veteran doesn't qualify, and there's different levels, and it's actually a rather complicated matrix to determine what amount of care do you get from the VA healthcare system, and it's not a very straightforward process to apply. And it's different levels of care based on disability, based on years of service, based on where you were, what theater you may or may not deployed in. And correct me if I'm wrong on any of that, Larry. But I'm also interested.
You're right. There's a lot of veterans who fall through the crack on counting all that stuff.
But I'm also interested for homeless veterans, and maybe Deborah could jump in as well. They must also have a problem just getting to facilities.
Yeah, so absolutely. So it's just like getting in the VA. It's a multi-level complex matrix of why aren't those veterans getting care. And this is something I'm very, very in tune with. So we have a great homeless program here in Tucson. But like Larry said, if you're not eligible for assistance or eligible for VA care, it doesn't matter how good the system is, you don't get that. And so, okay, so what made this person ineligible? Either they didn't finish their term of service or they got a dishonorable discharge. So there's like a whole generation of veterans that aren't eligible for services because, and in my opinion, they weren't ever able to complete their service because they came in with mental health issues. But those veterans are phasing out, they're older. The veterans we're seeing now are the veterans that are actually dealing with very real combat-related PTSD issues. And those are the ones that are suffering from, they're starting to come into that homeless curve. And this generation is very different. The past generations, it was a vet by themselves who had probably blown the relationships with their families and were living under a bridge. Our families have been conditioned differently. Now these veterans are showing up, they're women, they're men with families. Their spouses are going down the tubes with them. Their kids are on the streets with them. It's a different kind of demographic now than it used to be, Mark.
Mm-hmm. Hey, so Richard, I want to go back to you for a second here. It was based on something you said. So you were at the Prescott VA as an orthopedic surgeon, and then you left, and then it wasn't until you got back 23 years later. Is that math right?
That math is right.
That they have an orthopedic surgeon at a pretty big VA facility. So explain to me and folks that are watching this webinar, why is that? So why is there such a shortage of orthopedic surgeons? Is the VA not paying well enough? Are there work conditions? Like, what puts the VA healthcare system in a position where it can't attract a single orthopedic surgeon?
No, the answer is yes, yes, and yes. They don't pay orthopedic surgeon the market. And this back in 2008, when I started to wind down my surgical practice and do more consulting, I went to the VA at the urging of a nurse practitioner I'd known for 20 years there, needing the help. And so we looked into those different avenues. I chose to stay independent, not as an employee, mainly because of the kind of restrictions I would have in terms of my hours and whatnot. But I did look into options of salaries, and what they were paying an orthopedic surgeon there isn't market competitive. And the environment, quite frankly, is pretty tough. You're used to running your own office and having, your own efficient systems, your nurses. And when you get into more of a established hospital like the VA, there's a lot of red tape to everything. Yeah. And that includes the drugs, the formulary, physical therapy, the forms, the computer system, all of those things. And it makes it very undesirable for someone who really wants to get something done. But I chose to be independent, and I could see 20 patients in a day, whereas probably a staff orthopedist would see 10 patients. Yeah. And quite frankly, the nurses didn't like to be working with me because I was always making them work and hustle, and they'd be sneaking in the back room, going on the internet when I'm trying to get them to set up injections and things. And quite frankly, if I had my own office, they'd be gone that day as an employee. But
that becomes like a cultural issue within an organization.
Yeah, it is. Part of it's union, part of it's cultural, part of it's. But the fact that I just geared up so many consults, and I had patients from other VA systems coming in and very sad situations. MASH nurse from Vietnam that needed hip replacements, and she wasn't service connected. And so I had to pull many things to try to get her eligible. And I did get her eligible to outsource that into the private sector, but very sad situation. So, and I can get into more details about, recruiting physicians and in my view of what can we do to help the VA, and specifically the Prescott VA, because we're a little bit different than Tucson or Phoenix, because they did away with the surgical suite 2 years after I was consulting there in 1985. I operated just before they closed down the operating room. So a lot of that is, central administrative decisions to close down and centralize a lot of things. So Prescott had to send all of their surgical patients down to Phoenix or to consult with me in the private sector, because I had my own private practice, which I did even after I closed down my clinics out of frustration, quite honestly.
Understand. Let me go to Shanoa for a second. So Shanoa, first I want to understand when you left the Air Force. And
go ahead.
and then can you explain what kind of barriers that you faced in trying to get healthcare through the VA?
I got out in 2011, and I think there is a stigma with the VA, even when you're still active duty, like there's still, you don't really want to, you're like, I mean, I really didn't want to go get seen at all. So I actually didn't, my first appointment wasn't until 2017. And so it was a pretty tough process going through the CMP, the whole CMP thing. But like I said, I wasn't here in Arizona, but that, it was consistent though for a year. And then I moved to Flagstaff. And like I said, it was just really hard to get into the VA here at the CBOC. And so when I finally had my first appointment, it was just through, it was a Zoom appointment through with a primary care provider, but she told me up front that she was temporary. She wasn't going to be my primary care provider. She was actually just filling in for some, I think they were short a provider here at the CBOC. And so she was actually out of Prescott. And since that appointment, because I get counseling for MST and other things like they wanted to check my hearing, and I also have hypothyroidism, so they were trying to get me into like a nutrition class, and it's September. And as far as the counseling, as far as the I have an audiology appointment, and it's not until November. That was the earliest they could get me in. And so I think it's like mid-November is when my audiology appointment is here in Flagstaff. I haven't had a follow-up for the MST counseling, and neither for the nutrition. So
so you're experiencing, significant wait times for these follow-up appointments.
Mm-hmm. Or even just a follow-up. They were supposed to put me in contact with a social worker also, to possibly do an appeal for my rating. And so, but I don't know if anybody can attest to.
When you say your rating, you mean your disability rating?
Mm-hmm. So before I left the New Mexico VA, I was told by one of the social workers that I should do an appeal, but the whole process is just so, it takes a mental toll, and I think I'm trying to build myself up to try to just go through the whole process again, because I basically have to retell everything that's going on, and they do their whole checkup as far, because I have nerve damage in the right side of my arm, and it's pretty much going through everything that I'm claiming for all over again with the Arizona VA. And so it's just wanting to, I'm not there yet, like to get comfortable to kind of, because once I start, it's like you have to go through and do the whole thing. It's not like I can do part of it or I can take a break or whatever. And I think for myself, I would feel a lot more comfortable once they open back up where they can actually see me physically, because and I don't mind Zoom appointments, but it's just, I don't know how much you can get from that when you're trying to do like a comp and pen appointment, so versus like an in-person. So I mean,
let me go over to Jody for a second here. I want to understand a little bit more about the prescription drug issues with the VA and the U.S. Postal Service. So I understand that you rely on the VA to send you prescription medication. How is that system working currently?
It used to work really well. Lately, it's not working at all. I am diabetic. I also have high blood pressure, and I'm also got COPD. All three of those require medication, and all three of them require medication that I need to maintain, especially the COPD. About a month ago, maybe a little bit longer, I had an occurrence. I had a COPD attack, which basically my lungs filled up, and it was very hard for me to breathe and very painful. And the only thing that really helps me is, other than being hospitalized, which I try to avoid at all costs, is taking prednisone. It kind of relieves the wonder drug. So I called my primary care. Normally, under normal circumstances, when she ordered it, I would usually get it within 3 to 5 days tops. It took me over a week and a half to get it. By that time, my condition was worsened, and I was in barely hanging on without medication, short of having to go to the hospital. And during COVID, with my conditions, I don't want to go out of the house. So I'm not, in fact, I was hospitalized back when COVID started, back in April. I had the same thing. My lungs were filling up, although I had really bad chest pains. So they told me to go into the hospital. And so I got put on the COVID ward because they thought I did have COVID. And I was tested, and thank God I tested negative. So they released me. I had to go, you have to be tested twice before they'll release you. So
Jody, do you get your if you're taking insulin for?
No, I don't take insulin.
So have you had any issue getting your medication for diabetes then?
Yeah, all the medication so far. It's in the last, I would say the last 3 months, all my medication is running late. In other words, I do I use the My Healthy Vet constantly, and for communication for all. And so when I go on a Healthy Vet, when my prescription comes in, I automatically go in and refill it. So those come automatically. I've noticed even those are even coming in 5 to 6 days late from the date that they were supposed to be refilled.
Mm-hmm. Mm-hmm.
So I mean, it's not not really on the VN end. It's basically on the post office end, because from the day that they're shipped from the VA, when I get notification that hey, your prescription is shipped or whatever, I don't see it for over a week. That's ridiculous. That never happened before. And I do know, because of sources, I used to work at the post office back in the 80s here in Phoenix, especially, and I worked at downtown station. And there's a difference between first class mail and priority mail. Our prescriptions used to go out priority mail. They no longer go out priority mail. They now are classified as first class.
What's the difference in price? Do you know? What's the difference? What is the difference in price? Is priority mail twice as much or 50% more?
No, not necessarily. No, priority first class is your it's not really more money, but I mean I don't really know, because I haven't I worked at the post office in the 80s, so I don't really know the difference between the cost of it. But I do know that the difference between priority and first class is priority first class is a higher level. In other words, first class is here, priority's here. So, but what the difference is, I'm not sure.
Okay, so that slowed down the medications when they made that.
Yes, because they're not considered. Yeah, it's just like anything, like a package of third class mail. The same thing. So yeah, I
want to hear from everybody. I got one question that's basically to all of you, and if there was one thing. And this is either based on your own personal experience as a VA customer, or based on what you're hearing from other veterans, or based on Dr. Collinson from having worked at the VA. If there's one change that you would like to see in veterans healthcare that you think would be a positive improvement, what would that change be? And I'll start with Dr. Collinson here.
Mine would be to incentivize administrations for physician recruitment, because there seems to be a genuine lack to actually take those actions. Despite the Mission Act, which is maintain integral systems and strengthening integrated outside network, there is the idea is to source this out to the private sector.
Got it.
And it's not going to work because, first of all, the fees that they are paying outside physicians is even below Medicare fees, which is losing money for doctors. And the fact that the paradigm of physician private practices, like myself and my father and all of my brothers, is going away. It's almost gone now. Physician care now is in control of hospitals and hospital systems, so they become employees. And the disincentive, your question before, Mark, was what kept physicians from going to the VA is now is if they were to become at least competitive with either private or hospital-based physicians or specialists, this is the time where they can compete, because most of the millennial doctors graduating now are not interested in getting out and doing all the work of this, setting up your own practice and nurses and ordering supplies and drugs and everything that we've done as physicians. So, but there's still a lack of people, even let's say within our local VA, to actually want to attract physicians. We'll see what the Mission Act does.
Well, one thing I've come to learn about healthcare in our country over the last 18 months of running for the United States Senate is one thing is that residency programs just across the country, we have the same number of residents every year that we had in the 1980s, and we had a much smaller population. So as the population of our country has grown, the number of residents has stayed flat. So that makes it just a math issue that as there are more hospitals and clinics to try to serve more patients, well, the number of physicians are staying the same. So it's
very true.
Attract everybody. So there needs to be an effort, I think, at the highest levels within Congress to try to get the system where we have enough physicians, and maybe also for primary care, nurse practitioners and primary care doctors, but nurse practitioners can fill some of those roles as well. So Deborah, if there was from what you're hearing, either your experience as a veteran or from some of the folks you're hearing, what is one change that you would like to see in the system?
I think we need to cut out a ton of bureaucracy. I think that is what's killing our vets. I think, and it's funny, even now in this forum, the little bits that I'm catching from different people and in the committees I'm in and the veterans I work with every single day, I think the VA has the best intentions. We go in there and they want to do the right by us. And then we have our doctors and they're amazing and they will jump through hoops for us, okay? But then there's this bureaucracy that we have to navigate to get to those people, and it's a mess. And what happens, and not just in myself, but what I hear consistently with veterans is, even if they don't know how to verbalize why they're frustrated, it's a helpless feeling. You go in there and they have complete and absolute control over you. And if you think they're not abusive to us, then you're not hearing the true story of what's going on. I promise. Your CMP exams are there. They know that they can talk to you and treat you however they want. The doctors know that if they don't like your attitude that day, they can withhold your services and you have nowhere else to go and there's no one to complain to. I have an appointment next month or next week for my migraines that had to be rescheduled because community care screwed up my stuff last time. So this time around, my doctor called the office and said, let's get this right. We need you to fix the date on this authorization so that we can order her medication so we can treat her. And whoever they talked to, because they just didn't feel like it that day, said no. The director can't explain why. His secretary can't explain why. The director for community care can't explain why this person said no. And it was completely within their power to do that. Why? Let's ask the why question. Why is it okay for them to do that? Why is it that has to be acceptable? Why do we have to wait for the mail to bring our medications? Why is the mail contingent on politics when that's how we get our medicine every single day? Okay, why is politics part of that? Why does VA care come into play every time there's a political issue? It shouldn't be. It should not be a political issue. It should not be a mail issue. We should be able to go get our prescriptions. If I went to my private doctor, I could have my prescription called in. I could go to Walgreens and pick it up 24/7 from the drive-thru. But because I have to use the VA or pay out of pocket, okay, that's a whole other thing about veterans and what we earn after we get out. But I have to go to the VA for my care. So when I need my prescriptions, I have to find a way to get there on their terms, on their hours. How empowered do I feel as a veteran?
Yeah. Well, those are very, very good questions, and questions do have answers, but it
Mark, you won't like them. And I think a lot of people don't ask these questions because they're not thinking outside the box to ask them. Ask them. I ask them all the time. Nobody can answer them.
What I mean is that things can be changed.
Yeah.
And it is in the power of the federal government to make positive change.
I hope so. I believe in that.
Yep. So I'm taking notes here, and this is going to help me in my future job if I'm elected in November. Let's go to Shanoa. Same question to you. You know, one thing before we've got about 5 minutes. I also want to hear from Larry and Jody, but one thing that you would like to see changed from your personal experience.
I think just making the transition smoother for veterans who move. So like working at the VA, I just remember like a new veteran would move into town. They would basically have to re-enroll, even though they're enrolled, say, like me, I was enrolled in New Mexico. I have to create I basically have to send a whole new application for Arizona. And then it's like when they go through the appointments, they don't know anything about me.
Yeah.
And I thought, I mean, I kind of would hope that they would have like a system to where they could see my medical history already and know about the conditions I have, but they don't. And
Yeah,
so
having an electronic medical record that's portable, that could be accessed at any VA facility would make sense. I always thought that was a good idea. During the last administration in the White House, there was a move to an entire, nationwide electronic medical record system, and it became a political issue.
Because it was hard, like when you think about people that were traveling, like that are traveling for the summertime and they run out of medication, like just trying to get a hold of the travel nurse at whatever home VA that person was at, it's like a nightmare just trying to, but you can see like, the person will have the prescription, like I'm taking the medication and we're just like, sorry, like,
Yep.
good luck. And so I think it would be, they just all need to talk, I guess, and just make it easier.
Larry, how about you? What's one thing you would like to see improved or
I'd like to see them privatize the comp and pension part, and because I don't think they don't do us any justice. And you can't use your psychiatrist to object to it because they don't take that information. And going back about maybe 7 years, I had to use your wife's office to help me to get through to my claim, because otherwise they would have thrown it away.
Yeah, understand. And finally, Jody, you're gonna get the last word here before I've got some closing remarks. But what's one improvement in the system? I think it might have to do with prescription medication, but
well, it's a combination. I'm kind of amused because I'm hearing all this. I guess getting in when I did back in the 80s, and being in the system for so long, I have not seen some of these things that these people are seeing. My thing though is what I'd really like to see changed is the communication between the different clinics and your primary care. Everything has to go through your primary care. And with me, I have like 3, 4, 5 clinics, and they're not talking to each other. They don't communicate to each other. There's no communication within the VA as to the care of that particular veteran. It's like, it's sporadic. It's like, no, not one hand doesn't know what the other hand's doing. And every time you go in for a condition, whether it's, I've recently had back problems. I've had 2 back surgeries. Every time I've had to go in, every time it's the same thing. Well, what's wrong with you? Well, why do you need surgery? And you go through the whole spiel all over again. There's no communication as far as what the patient is.
Well, I've taken some notes. This is very helpful for me. So thank you everybody for taking the time. Deborah, Jody, Larry, Shanoa, Dr. Collinson, I really, really appreciate it. It's clear from our conversation today that we owe our veterans, better when it comes to healthcare. And I've also, just to be, fair to the VA, I've talked to some veterans where they feel it works very well for them, but a lot where it does not. And I used to, Dr. Collinson, I think you mentioned up front that you're from Iowa.
Yes.
And I have a former commanding officer of mine in the Navy, a guy named Terry Toms, who I really looked up to. He was my boss when I was flying off of an aircraft carrier in combat missions over Iraq and Kuwait. He was from Iowa.
Oh,
And
good.
he used to always say to us, if you're not changing it, it's getting worse. So change is good. Process improvement, looking for, places where you can just like make it a little bit better, finding the problems and then trying to solve those problems. Unfortunately, a lot of this stuff becomes political, especially in big government agencies with a lot of bureaucracy. But if I have the honor of being elected, I'm going to be fighting to make sure that veterans get the health care that they need and that they've earned, and make sure they get their prescriptions on time. Also that we protect Social Security and Medicare from cuts as well. That has a big impact on veterans. Finally, we've got to all, work together as a team here to slow the spread of this virus that's really impacted Arizona communities. And often when something has a negative impact, it often negatively impacts veterans even more. And in this case, veterans who often have a hard time accessing healthcare services. And finally, I really care about science. So if elected, I'll be trying to make decisions based on science and data and facts and not politics and politicizing everything. So for everybody out there watching, thank you so much. Thank you for, I was looking at the chat here a little bit. I think his name's Sachin Biliar, answered my question there that I asked Jody about the first class versus the priority mail. He says priority mail $7. First class is the regular stamp, so that's significant. I'm going to go check that, but I'm sure Sachin is probably correct here, but we'll take a look. Thank you, everybody. Thanks for joining us today, and hope to see you all soon in person, and stay safe.
Thank you.
Thank you.